welcome to podcast number 46 of NICU and Beyond with Tracy and Stacy. We certainly hope you had a wonderful holiday season, and we're going to start off with the topic of Neonatal Abstinence Syndrome, or NAS. NAS is a group of conditions caused when a baby withdraws from certain drugs. Most often, those are opioids that they're exposed to in the womb before birth. Most babies with NAS get treatment in the hospital after birth. Most babies get treatment and get better within like a few days or weeks. During treatment, your baby may be fussy and difficult to soothe. Skin-to-skin care, swaddling, massage, energy work, breastfeeding, and being gentle, and certain types of ways to position your baby will help calm them. NAS may lead to long-term health and development problems, including hearing and vision problems and problems with learning and behavior. Now I'm going to let Stacy talk about what actual definition of NAS is.
What is Neonatal Abstinence Syndrome, or NAS? This happens to babies who were exposed to potentially addictive drugs before they were born, as Tracy said. Some examples are prescription drugs, oxycodone for chronic pain, codeine, Vicodin, Percocets, Tramadol. Also, illegal drugs, street drugs, cocaine, crack, heroin, crystal meth. Some babies also have neonatal abstinence syndrome if the mom is on SSRIs or for stuff for mental health, such as Zoloft or Prozac. We will see neonatal abstinence syndrome in some of those babies too. And we also see some signs of neonatal abstinence syndrome in babies that moms have smoked many, many packs of cigarettes. Not so much alcohol, but alcohol does another problem. Alcohol, if a mom drinks a lot of alcohol during the pregnancy, the baby could develop fetal alcohol syndrome, and we will do a podcast on that in the future. Depends on which drug is used, how often the drug has been used, how much the drug has been used, and whether the baby was born prematurely. Usually babies with addiction that are born at like 27, 28 weeks, we won't see as much of the addiction or the NAS syndrome just because the baby hasn't been exposed to it for 36, 38 weeks. The other thing is if you are on any street drugs, heroin especially, you can ask your doctor and do a conversion whenever you want to do and then the conversion they will transfer you and you'll be put on methadone. Just to let you know that we do get a lot of babies that are on methadone. It really doesn't matter how much methadone that you're on. We've had babies that the mom's been on 20 milligrams of methadone, and that baby is really crazy with the symptoms of neonatal abstinence. We've gotten babies that the mom's on 50 or 60 milligrams of methadone, and those babies are good. So it's all a lot of the genetics, too. It's let the providers know that if you don't get converted to methadone, yes, babies that are on street drugs, crack, cocaine, heroin, they will go through the withdrawal quicker and not as long. Babies that are on methadone is very hard to get off of. We'll talk about the ways that we get these babies that are on methadone, how we treat them.
So we're going to talk about some of the symptoms that we might see with NAS. And I have to tell you, working with these babies, it was truly a passion of mine. And I think Stacy agrees that she loved working with the NAS babies as well and their families. Some of the symptoms can be very sad and disheartening, but we know that this will not last forever. Like Stacy said, it depends on the type of drug that they use, how often, how long the drug was used, how much they use, and whether the baby was full term, which a lot of my babies that I worked with were, versus a premature baby. The biggest symptoms, and this is not exclusive list, excessive crying and or fussiness. And when I tell you crying and fussiness, that's an understatement. Very high-pitched cry and very, very loud. Very hard to soothe and comfort. Poor feeding, or they overeat until they throw up. I remember, people try and keep them quiet by feeding them, but you can only feed a baby so much food before they start to throw up. Fever and sweating, so like they were very hot baby. Rapid breathing, so like they'd have a really high heart rate. Blotchy skin. I'd see modeling when their muscle tone was really tight. You could actually see some of that modeling going on in their skin. The biggest one, I think, is the diarrhea and sometimes vomiting. But the diarrhea would just break down these poor kids' skin. There was nothing worse than, trying to clean their bottoms up, and then not even 10 minutes later, it's just coming through them because that's just part of the withdrawal. Increased reflexes, increased muscle tone. We do a lot of massage, which we'll talk about in a minute. Some of that increased tone and reflexes that they're hyper, they have a lot of trouble sleeping. As an OT in therapy, I did a very holistic view, and I will talk to you about that in a few minutes. You'll definitely see stuffy nose and a lot of sneezing, lots and lots of sneezing. And it's not because they have a cold. It's just part of their withdrawal. Or allergies, correct. And then the last thing is, if it's really bad and we really have to watch these kids, some of them can actually have seizures and really severe tremors. Stacy is now going to talk about 2 different scales that the nurses use in order to assess how severe the symptoms of NAS is.
So there's actually 2 scales that nurses and doctors, nurse practitioners use to basically the symptoms of NAS. Many, many years ago, we used the Finnegan scale, Finnegan. The Finnegan scale is you gave points for each symptoms that you saw. If the baby sneezed 3 times in a row, that was a point. Did they wake up more than every hour? How long did they sleep? Did they have tremors? Tremors with cares or tremors just laying there in the bed? The medical community went to a scale called Eat, Sleep, Console. And the Eat, Sleep, Console scale really works when the baby's on pediatrics with the parent. We in the NICU don't really care for the Eat, Sleep, Console because it's about the parents being involved with the care. And a lot of times if the baby's in the NICU, the parents aren't there 24/7. And that's not the parents' fault. In our NICU, there's no room for the parents to be at the bedside for 24/7 unless we put them into an isolation room. We can turn out the lights. And sometimes we did do that with the NAS babies that were really having issues. When we say that your baby's crying at night and you might have went in there and done everything for that baby, changed their pants, fed them if they were due to eat, do the 5 S's, console them. And sometimes you just had to shut the door and walk out. These kids like to excessively suck. With the treatment, we usually gave morphine, and we would give morphine every 3 hours. The morphine would be by mouth or PO. We also have given sugar water called dandelion kisses, because sugar water with the sucking. Some of the babies will start at the lowest dose of the morphine, and then if it's not helping with the baby, they will go up. Then the baby will have to wean from the morphine before they go home. It's a vicious cycle. We know that it's out there in the community. Tracy's going to talk about the 5 S's and some holistic approaches to NAS.
Like Stacy said, there are some non-medical things that we can do for our NAS babies. The first one is called the 5 S's to soothe your baby. That is when you swaddle them a certain way with their hands at their sides. We put them in side-lying position with the head kind of down. Then we do the shh, 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 or shushing sound. And then we kind of do a nice sway back and forth or swinging, and we cannot take for granted the pacifier and them allowing to suck. One of the other big things that I did was doing a lot of infant massage. I find infant massage has benefits for all babies. I did a lot of massage on the babies before they ate, made sure that they had their pacifier at the time, and then I would just do one extremity at a time while the rest of them was swaddled. I could keep them as calm as I could, or I held them very tightly while I was doing their massage and having their pacifier in. I also did some Reiki because I feel that their energy just needed to be calmed and relaxed. So being a Reiki practitioner was very beneficial for me to help these babies. And a lot of times they'd calm out so much between that and the massage that they would pass out. And then the nurses would come to feed them, and you couldn't awaken them because they were so calm and relaxed. There are other things that you can do for these babies. You know, we don't want to put every single child on medicine if we don't have to, but always turn down the lights, make it as calming and quiet. The less you talk, the better off for your babies. I'm going to let Stacy give you some last minute thoughts before we finish up.
When you take your baby home that had NAS syndrome, when you take the baby home, yes, they're not on the morphine anymore, but you really need to be at the bedside learning your baby's behaviors, because unfortunately, when these babies go home, they still continue to go through the withdrawal process. Unfortunately, I know a lot of people that do foster care, and one of the number one babies for foster care are babies with NAS. You have a baby with NAS syndrome, make sure that you have somebody that can come over and let you go take a bath and you to de-stress for a minute or two. But just to let you know, these babies are not over their withdrawal when they go home, and that you are going to have to deal with that. Get with your early intervention. There can also be different kinds of follow-ups that your pediatrician might want you to do. Make sure that you take your baby to all their follow-up and baby checkups, even if you think they're doing well. They might have problems with their nutrition and growth. They could have some developmental delays and problems with motor and learning skills, problem with hearing and vision, and problems at home. Babies with NAS, as they get older, they have an increased risk of themselves having behaviors, drugs, alcohol. These babies all deserve a chance. But I know just from previous experience and talking with some nurses that were foster parents and took NAS babies home, these babies really, truly do still continue to withdraw at home.
I hope you found this information on NAS helpful to you. If you liked it, please like us. Better yet, follow us. You can find us at www.parentnicuconnection.com or at my new website, which is https://peds, PEDS.thinkific.com. We'll have a new and exciting topic in a couple weeks. I hope you have a great day. Bye-bye.
Bye.